Good morning, everyone, and welcome to this discussion with medical health professionals on guns. It is an opportunity for us to really dig into an issue that has a significant impact in our communities, on the lives of Canadians from coast to coast to coast, and particularly on the medical professionals who respond to gun violence on a weekly basis right across the country. We know this has a huge impact on Canadian families, on communities. That's why we've taken significant measures over the past 4 years as a government to strengthen gun control, but we recognize there's more to do. That is why we're moving forward on banning military-style assault weapons. We're going to be moving forward on allowing cities to restrict or ban handguns. We're strengthening various other gun control measures, and the choice is very clear in this election. We want to strengthen gun control with significant real measures that are going to have an impact, and the Conservatives want to weaken gun control, which I think is the wrong choice for Canadians. But I'm looking forward very much to hearing from the experts gathered here today. And I want to start with Dr. Najma Ahmed, who was on call the night of the Danforth shooting that so many people remember here in Toronto and indeed across the country. Can you share with us a little bit your perspective on that night and what has ensued?
Thank you, Mr. Trudeau, Prime Minister, for including the voice of doctors and healthcare professionals in this important discussion that affects the health of all Canadians. Indeed, I was on call the night of the Danforth shooting, and it was a horrific and terrible experience. You know, we train for these kinds of things all the time, mass shooting events and mass casualty events, but we hope against hope that we never have to bring our expertise to bear. Canadian doctors and traumatologists have for a long time been concerned about the rise in gun violence in our cities. But I think what happened on the night of the Danforth is that all Canadians became aware and awakened to the reality of gun violence, and that we're really not that different. And if we don't act, terrible things could happen. I ask all of our elected officials to understand that harm, injury, and death from guns is a preventable public health crisis, and that legislative action is necessary. A multi-pronged approach is going to be very useful, but we have to change the laws. I am a trauma surgeon, and I've worked at St. Michael's Hospital for 20 years. Last week, I operated on a long-time patient of mine. It's a terrible story of a young man injured by a spray of bullets. He happened to be at the wrong place at the wrong time. And last week, he underwent surgery, 6 hours of reconstructive abdominal surgery. And this was his 9th operation. Over the 3 years since his discharge from hospital, he has been unable to return to work, in and out of hospital, on and off intravenous nutrition because his gut simply doesn't work. Perhaps many people imagine that after our heroic paramedics transport the patients to our trauma bays and those trauma bay doors close, that the doctors and nurses busy themselves and patch up the patient and make them well again, and they get to go home in a matter of days. But for the majority of patients, that simply is not true. That's the furthest thing from the truth. These patients require upwards of 100 units of blood sometimes in the first 24 hours. Many, many operations to reconstruct them and bring them back to life. They spend weeks and weeks in the ICU, their lives hanging in the balance, their families at their bedside. We doctors walk past them trying to give them hope. And if they do survive, they spend months and months in hospital and then rehabilitation. That's the reality of gun violence. And something else I want all of our elected officials to understand. The effects of gun violence reverberate for years and decades and generations. Our patients and their families are never the same. Our patients are left with lifelong disabilities that they live with, and they live with life-altering circumstances, and the psychological burden of being a gun violence victim. Doctors and nurses and other healthcare professionals who treat these patients see it as our responsibility to inform you of our lived experience so that you can make better decisions on behalf of all Canadians. And doctors have always participated in these difficult discussions and the discourse around public health. Think about tobacco and asbestos and seatbelt laws. We always get into it when people's lives are at stake. We have witnessed an escalating pace of violence in our city. In 2018, there were 425 shootings in Toronto, and 2019 seems worse. We cannot afford to remain silent, and we will not accept the status quo. Canada must follow the example of countries like Australia and New Zealand, United Kingdom and Netherlands. Legislative action is needed to stop the proliferation of guns in Canada. And we know that countries with stricter gun laws have lower rates of gun homicide, suicide, femicide, intentional and unintentional injury. I ask you, Prime Minister, and all of our elected officials to consider the weight of the scientific evidence that clearly shows the proliferation of guns makes us all less safe. I ask that you hear the tragedy of our daily lived experience and the devastation of people personally traumatized by gun violence. And I ask the government to act.
Thank you, Najma. I want to turn now to Dr. Joel Lexahin, who's been had a number of years in an emergency room. Have you seen gun violence and the victims of gun violence evolve in terms of the frequency, in terms of the intensity, in terms of the stories and families that are around them?
Well, I work at University Health Network. We used to be a trauma center, so we used to see gun violence. We haven't been a trauma center now for 25 years or so. So I don't see it directly, but I do hear about it from my colleagues who work in the emergency department. I hear about their concerns, their worries about things. And while I appreciate the efforts that your government has announced, I think that the idea of letting cities ban handguns is the wrong idea. There are provinces out there. This is going to have to be done at a provincial level. The provinces are going to have to allow the cities, and there are provinces with leadership out there that are not going to accept this. And even if provinces do accept it, Toronto may do it and Mississauga may not do it. You just cross the 427 and you can purchase handguns. I think that that's the wrong approach. I think that what the federal government needs to do is show leadership and do a national ban on handguns.
Thank you, Joel. Obviously, it's we've taken a significant step, and there's other measures that we've put in place around controlling bulk purchases and making sure that handguns don't end up on the streets as much as we possibly can. But we recognize that this is a first important step, that there are lots of people who would like us to go further, and I hear you on that. Perhaps turning behind you to Dr. David Gomez, who is a trauma surgeon in currently dealing, I believe, with gun violence on an all too regular basis.
Prime Minister, when I was thinking about this, I wanted to share a story with you. It was early in my practice. I was just gotten home from a long day of work. I didn't even have a chance to say hello to my little guy, and I would rush back to the hospital. I was greeted in the trauma bay with 2 critically ill gunshot wound victims. The team worked frantically to save their lives. We performed emergency surgery and unfortunately were unsuccessful. We had to make the long walk, talk to the family members. The patients and the families' lives changed forever. I was sweaty, I was tired. I got back home. Even before I put my head on the pillow, I rushed back. More surgery, more injuries, more death. The same story repeated over the weekend. About 5 or 6 gunshot wound patients came in that weekend. We operated on all of them. And I thought to myself, there has to be a one-off. This is in Toronto, this is in Canada. And unfortunately, I realized that it's not a one-off, it's routine. We see gunshot wound victims in trauma centers every day. Patients' lives end every day, and their families' lives change every day. By the end of that weekend, my shoes were bloody, and they sit in the corner of my office. And either little shoes or non-little shoes are in offices of every trauma surgeon. They remind us that it's not just our job to fix these injuries, it's our job to help prevent them. We have not only the legislative tools, and we're not naive. We understand that not one intervention is going to fix this. This is a multi-pronged approach. interventions for assault are going to be different from unintentional injuries and are going to be different from suicides. But we need the tools, not only from a legislative aspect, from a research aspect, to be able to intervene. We need to be able to see the data and act on the data. And I think we were talking today that we actually don't have those tools, and some of our privacy legislation really limits us in being able to study these as the disease that it is. Firearms are vectors of disease, and we need to understand the host and the vector to be able to intervene.
Thank you very much, David. Beside you is Dr. Anna Dare, who's a general surgery resident at the U of T, but also originally from New Zealand. And obviously New Zealand has been part of the conversations we've had internationally this year following the terrible Christchurch shootings and the leadership that the New Zealand government, led by Jacinda Ardern, have taken on banning military-style assault weapons. We are going to be moving forward in a similar way. But perhaps you could share some of your perspective on this issue.
Thank you, Prime Minister. So when I immigrated to Canada in 2014, I have to say I never thought I'd be sitting here today talking to you about the destruction I see every day from firearms in my work. And that's partly because I thought Canada didn't have a gun problem. I'm sadly here to tell you it does. Every day this summer, while I've been on call, I have seen gunshot wound victims. I've treated them. I've had to teach my medical students how to come and counsel families when they've lost a loved one. Our 2 quiet rooms at Sunnybrook Hospital, there have been nights where we have had too many families and not enough rooms. So there is a problem, and I think similarly to in New Zealand, we had a not us, not here attitude. Don't let it become too late. There is already a daily surge of violence in the city, not just homicides, but also firearms that are used in suicides and accidental shootings. And I think there are many examples of strong legislative actions that have occurred in other OECD countries that have significantly improved the number of deaths from firearms. For a long time, there was complacency in New Zealand, I think. I don't think we woke up and suddenly decided that we needed to change legislation. There wasn't a motivation to do so. And I would hope that it doesn't take a shooting of 51 people from your community to make you act. This is a public health issue. This is not a partisan issue or a political issue. And it is particularly only in North America that it has become one, I have to say. We must see this as a community problem and as a health problem first and foremost. Firearms are one of the leading killers of young men in North America. They've had a bigger impact in terms of mortality than road traffic injuries and HIV and AIDS over the last 25 years on our continent. And we must treat them like the public health issue that they are.
Thank you, Anna.